Hello and welcome everyone. I'm Dr. Maria Atkins, owner and medical director of the Cosmetic Enhancement Center of New England.
And I'm Sarah Chaosis, PA. We're thrilled to have you join us for our Ultimate Skin Health virtual event featuring our CO2 laser technology.
By joining tonight's event, you will have the opportunity to submit your questions by the Questions tab and have them answered live, so please stay tuned until the end for our live Q&A.
As a thank you for attending our event, you will qualify for an exclusive promotion.
Get 20% off any CO2 laser treatment at CEC.
Also, everyone in attendance will qualify for a raffle for a completely free Cool Peel treatment.
Remember, prize winners will be notified by text, and our specials are valid for purchases made by the end of the month of May. So don't miss out on these amazing offers.
Thank you and enjoy the event.
The CO2 laser works by creating thousands of tiny microchannels in your skin.
These microscopic pathways are not only channels for energy, but also as signals for jump-starting your body's natural healing process.
The laser precisely vaporizes columns of tissue, which in turn triggers the production of fresh collagen and elastin, those proteins essential for smooth and firm, youthful skin.
What makes this technology so special is its fractional approach.
Instead of treating the entire skin surface, it leaves bridges of untouched skin between those treated areas.
These healthy islands serve as reservoirs that help speed up the healing process.
By only targeting a fraction of the skin at a time, the CO2 laser minimizes downtime compared to fully ablative CO2 lasers, while delivering transformative results.
Whether you're looking to smooth fine lines or improve overall skin texture, this method offers a balanced approach, combining effective resurfacing with a safer, quicker recovery.
Our CO2 lasers are truly versatile, effectively addressing a wide range of skin conditions.
It's been used successfully to smooth wrinkles, reduce the appearance of acne scars, and soften fine lines.
Patients also see improvement in age spots, sun damage, and uneven pigmentation, making it a comprehensive solution for skin rejuvenation.
By targeting these specific issues, the treatment works to enhance overall skin tone and texture, bringing balance and luminosity to your complexion.
The laser not only treats the visible concerns, but also stimulates deep collagen production, resulting in more youthful, even skin appearance.
Whether your concerns are localized or more widespread, our CO2 laser treatments are tailored to help you achieve healthier, more vibrant skin.
One of the greatest advantages of our CO2 laser treatments is that it can be tailored to your needs for downtime.
We can offer an aggressive treatment with downtime lasting a week to 10 days to a much lighter rejuvenating treatment that can have a downtime as little as 3 days.
After healing, many patients notice significant improvement within a few weeks, with maximum results typically within 4 months.
The process is gradual, yet powerful, setting you on a lasting journey to revitalized, youthful skin.
Your transformation doesn't stop after your treatment. It evolves as your skin renews itself over time. So welcome, Leah. I understand that you're interested in the CO2 laser.
Yes.
What is it that you're interested in achieving with this?
Well, I was just hoping for like my pore size and maybe some texture, I don't know, does it do any discoloration?
Yeah, so the CO2 laser will help with the pore size. It'll help to tighten the skin, help with fine lines, and you'll get kind of a peel of your skin as well. It's like a laser peel. You'll see pigment improve. Oftentimes even redness will improve. Sometimes the blood vessels in the skin will get better as well. So evening out of the skin tone as well as the texture of the skin.
Awesome.
Have you had any laser treatments before?
I've had some lasers, but I've never had any of the CO2 lasers.
Okay, so you kind of know the snappy feeling of a laser. Typically a CO2, you'll have a little bit of sting with each pulse of the laser. It feels hot and stingy, but we mitigate that with both a little bit of topical lidocaine. So we'll put that on your skin for about 45 minutes prior to, so that it penetrates into the skin and makes it much more comfortable for you. The other option is, additional option is a little bit of Pronox. So you can use that. It's a laughing gas, so that you can use that during the procedure, make you feel really comfortable and less anxious about the procedure altogether.
Okay.
Any other questions?
Can you do it on other areas, or is it just on your face?
Yes, now you can do it on other areas. We're definitely much less aggressive on body parts because they tend to take a long time to heal. The face is very vascular and heals within about a week, but the neck, the chest, the arms, those typically take a good 2 to 3 weeks. So we don't want to do those too aggressively. We might do cool peel settings, but we might do more of a mid-level setting for the instead of an aggressive CO2.
Okay. And what would it just like do tightening for really your neck and stuff, because you don't really have like the pore size issue?
Yeah, it would be more textural tightening, not lifting like some of our other techniques, the Ultherapy and Soft Wave and Virtue. It's going to be more of a textural tightening, getting that surface texture, the crepiness in the skin.
Okay. And so since this is a laser, it's not going to have like the pinpoint, like the microneedling?
Right. So with microneedling, that leaves little channels where you bleed. That generally doesn't have that with the CO2, although somebody who has a lot of superficial vessels might see a little bit of that because it does go deep enough to hit some of those vessels, but most people don't have any bleeding whatsoever afterwards.
Okay.
Hi everyone, welcome to today's event. I appreciate everyone coming. We had quite a number of people reply and are interested in the CO2, so I'm so glad to see so many show up. There's already questions coming in, but I do want to again remind you that we will have some specials and we'll be doing a raffle, so make sure you respond to your text afterwards and get information on that. We have the question and answers rolling in now. I'm going to answer those as best I can and try to answer all of them if I can. I did want to mention that Sarah unfortunately couldn't make it tonight, called in sick today. Unfortunately, she's not feeling well, so it'll just be me, but I'm sure I can answer all the questions. So I'm going to get started right now. We have starting at what is the downtime? Okay, so we have a couple of different options for treatment. There's the cool peel, which is a lighter setting on the tetra laser that allows for stimulation of collagen and improvement of some acne scarring, things like that, and just prevention, and has very little downtime. We can do a mild, moderate, or aggressive cool peel, which will have anywhere from 2 to 4 days of downtime. Typically, people will do the moderate one and have about 3 days of downtime. Some people are a little bit longer than others. Everyone heals a little different, but on average, it's a few days of downtime. And the downtime is not generally crusting. It's just a little bit of redness. Your skin looks a little sunburnt, and that's it, basically. There's no scabbing or crusting or anything like that. And sometimes your skin will feel a little sandpapery. So it's not easy to put anything on it. You put moisturizer and maybe a little bit of Aquaphor afterwards, but not really any makeup for a few days. If we're doing an aggressive CO2, typically somebody comes in and they have, some really textural issues and wrinkles, lip lines, all of the under eye wrinkles, things like that. You're going to want something more aggressive. And that aggressive treatment can range anywhere from 7 to 10 days of downtime. I recently had one done about 5 weeks ago. During the videotaping of the event earlier, you saw I was much redder than I am right now. I was still healing from the treatment, and I had an aggressive treatment. I had a significant swelling for 2 days, and then crusty, peely, flaky for another 5 days or so. And even some of the spots where there was a little overlap or a little, sensitive tissue, I had even some crusting up to about 10 to 11 days after the treatment. And then I was red. I'm still a little bit red after the treatment, significantly noticeably red for about 3 weeks. And that can happen anytime you do an aggressive treatment for any skin tone, but particularly an olive skin tone person will possibly produce even some pigmentation afterwards for a short time. Please discuss the heat from the laser and how to keep it tolerable. So treatments, again, range in aggressiveness, and the lighter cool peel treatment, there are people who don't even numb for it and do fine. Definitely numbing for it, I recommend. Why not? Put some numbing cream on for a half hour prior and it'll feel really comfortable during the treatment. But there are people who don't numb at all for the cool peel, but that's a very light treatment. For an aggressive treatment, it's really imperative to numb. You need that numbing cream to get through it. And I found the numbing cream extremely helpful. There are definitely places at the edge of the hairline, up under the nose, and right at the lip line where it was much more sensitive. But areas in the middle of the cheek, I barely felt it. So the numbing cream is paramount. But there's also the option of, if you're really concerned, we can get you a pain medicine prior to. If you want to do the Pronox is excellent. It's basically laughing gas. And just like if you went to the dentist and had that at the dentist, it just makes things so much easier. You feel more calm, less anxious about it. So that's a really nice addition to the numbing cream. How does this compare to Virtue regarding results? Okay, so with Virtue, you're not going to get quite as much. And so if anybody doesn't know, the Virtue RF treatment is our microneedling radiofrequency treatment, which is fabulous for skin tightening too, and for texture improvement. You're not going to get as much texture improvement with the Virtue as you would with an aggressive CO2. However, the amount of heat delivered deeper in the skin with the Virtue treatment might create a little bit more lift in the skin. So the CO2 is very surface oriented for that texture. It's not as much for the lift in the skin. So people do both, but if you've got to pick one or the other, if you need more lift, then a series of Virtue treatments might be a better choice. If you need more fresh new skin, that peel of the surface of the skin, then a CO2 is going to be more results. And definitely for those lip lines, those deeper lines, you're going to get a better result with a CO2 treatment, aggressive CO2 treatment. A cool peel, on the other hand, would probably be set down from the Virtue with regards to result, but that's fantastic for somebody who's in their 30s, just wanting to stimulate collagen. Preventive maintenance. A lot of young people are really into doing that preventive maintenance, which I think is fantastic. Wish it was available when I was in my 30s. How does it compare? Oh wait, that was answered that already. Does this help with deep wrinkles? So yes, it can help with deep wrinkles. It's not going to help with folds. So like a nasolabial fold that is hanging down over, your mouth area, it's not going to really lift that, but it'll help with the textural lines within that and deeper lines in the lip. You'll see smoother lines. It's, can we be extremely aggressive in, certain areas so that certain areas are more result than others so you don't have the entire face treated aggressively? Yes, absolutely. This is completely customizable to the person. And it really depends a lot on what you're willing to go through for your downtime afterwards. If I scarred from a laser mole removal, is it possible to scar from this treatment? Now, this is a little different. A laser mole removal goes deep down in a full thickness fashion. CO2, fractionated CO2s are done in a way that it's pinpoint pattern, creating columns of ablated tissue with normal tissue surrounding each ablated column. And the reason that's done is because it is safer and you're not going to get scarring with it. You're actually going to re-epithelialize and reform your skin much faster and without any time for scarring or any surface area for scarring. So unless somebody didn't know what they were doing, you really shouldn't scar from a fractionated CO2 laser. I had a Neogen done about 9 months ago. It was very expensive. I was hoping to see better results. What is the difference between this and Neogen besides the downtime? I'm not really familiar with what the Neogen is. However, I will check that out for you after, and I will personally respond to you, get you an answer on that. I'm not quite sure what the Neogen is. Can you have this with filler? Absolutely. In fact, this is not going to replace filler. Filler is just like it sounds, filling in lost volume. A CO2 laser is not going to give you volume in your face. It's just going to help with the texture on the surface. Sometimes volume is necessary as well. So for instance, somebody who comes in and has deep, deep wrinkles in their lips and their lips have shriveled over time. Someone like that, I might recommend that they start with filler just because their tissue has shrunk so much. You need some support underneath the tissue. You need some volume underneath the tissue. You don't have to have big, huge lips in order to get some improvement there, but a combination of a little bit of filler just to bring back some of that volume, and then over the top of it, treating the CO2 aggressively to smooth out some of those lines. That combination is usually the best. And I tell that to people all the time, all day long, that don't rely just on Botox. Don't rely just on fillers. You need to think about treating yourself in multiple different ways. A little bit of this and a little bit of that, and you're going to get your best result. Can you also get this if you have Botox? Of course, yes, you absolutely can. The only caveat between Botox filler and any laser treatment, including CO2, is that after you've had a Botox and laser treatment, a Botox and filler treatment, you're going to want to wait at least 1 month before you put any heated device over that area. So that would include a CO2 laser. So you don't want to deactivate your Botox, and you want your filler to set up shop in your skin and be, meshed in with your skin before you actually heat it up with the laser. So 1 month is a rule. Wait 1 month after any Botox or filler treatments before you do a CO2 laser, or any laser really, over that area. How effective is the treatment for deep 11 lines? So it can be effective, but it's not a sole. I wouldn't recommend that solely. You can see some improvements, absolutely, but the lines are caused by the constant frowning in that area, the constant motion of those muscles. So doing a little bit of toxin along with it is really preferable. So if you do toxin and it's relaxed and it's better, but it's not gone, then yes, the CO2 is a great addition to that. But if you're trying to avoid a toxin by doing a CO2, you're probably not going to be happy with it. You're going to want to do a little bit of relaxing of that muscle as well. Can this procedure take care of precancerous sunspots? So yes, oddly enough, in the last couple of years, there have been a lot of studies showing that many laser treatments, not just the CO2, but especially the CO2 laser, can be preventatives for skin cancer because you're actually treating some of those precancerous lesions. They have shown that if you aggressively treat a precancerous lesion on one side of your skin, that not only does that respond, but one on another area actually responds even without treatment. It's basically immune modulation. Your body is healing and motivated to heal and stimulated to heal, and so you're getting some improvement throughout your skin. So it's definitely a treatment that I I do recommend for people who do get a lot of precancerous lesions, in addition to maybe photodynamic therapy, which is FDA approved for treatment of precancerous lesions. Both of them are very rejuvenating, and both of them will prevent skin cancer. I think that the more you can prevent that, the better. You don't want to have things biopsied and cut from your skin, because the scar is hard to completely get rid of. Yes, they can look great afterwards, but sometimes they don't, and sometimes it's almost impossible to make them completely unnoticeable. So definitely a good option. Wondering about the price. Okay, that's a good question. A full face CO2 like what I had, which was basically the full face without the orbital socket area, and that is $2,200. If you're going to add eye shields, which are kind of like little contacts, you don't do it, I do it. We put it into your eye after a little bit of topical numbing and topical lubricant to the shield. We insert those underneath the lids like a contact, and that protects the eye. If we do that, we can treat right over the eyelids, right to the eyelashes, and that is an extra $300 charge. If you're going to do a cool peel, then a cool peel at the lighter setting is $1,250, $1,250. What brand? Okay. Yes, next one is, what brand model laser do you use? So we have a couple of lasers, the Total Effects laser with the deep and active effects, as well as the Tetra Cool Peel Tetra laser. The Tetra is able to do a deeper, more aggressive, but also the lighter cool peel settings. Can you please explain the difference in Virtue RF and CO2 lasers? So Virtue RF is a microneedling radiofrequency treatment that delivers the heat down below the surface of the skin with needles, and delivers a lot of heat to cause some tightening of the skin, and will also help a little bit with the texture too. The CO2 is purely a laser light-based treatment, meaning it's not just heat. And using that laser light, you're basically causing peel of the skin, fresh new skin. Your skin will be raw afterwards. With the Virtue treatment, you're not raw afterwards. Can you do just one targeted area on the face? Absolutely. If you only want to do, say, around your mouth, you can just target around your mouth. You'll have, easier time for healing that area, because it's easier to take care of a smaller area than it is a bigger area. That's why a lot of times I don't recommend doing, full face and neck of CO2. That's a lot to take care of afterwards. Unless you're doing a really light treatment, it doesn't make a lot of sense. It's a lot of work, and it's daunting for those first couple of days when you're really swollen and you're doing vinegar and water soaks 5 times a day, and you're putting Aquaphor on your skin. It's nice to have a focused area. Best to spread those treatments out. Are there age restrictions? Not really. I mean, I'm generally don't need to treat kids. That's not usually an issue, but you can, as long as you want some improvement and textural improvement, you can absolutely do it, no matter how old you are, or depending on the reason for the treatment. I've treated the CO2 on teenagers with scars, so it really depends on the person. So definitely, if you're concerned about it, just give us a call and we'll do a consultation. I'm debating between this and microneedles. What would you recommend? So the microneedling, plain microneedling, I generally only recommend that for really under 40 age, because if you're going to do it microneedling, you might as well add the radiofrequency to it. So a microneedling radiofrequency treatment helps with tightening, and pretty much after the age of 40, everybody has a little laxity, and a little tightening is very helpful. So the microneedling with radiofrequency is much preferred after the age of 40. What is the cost? How many treatments do you need to do? So generally, people don't do more than one CO2 treatment if it's an aggressive treatment. If you're doing a cool peel treatment, then you're probably going to want to do a series of 3 treatments. The frequency after that most people are going to do something once a year to help keep up with the aging process. Does it have to be a CO2 every year? Does it have to be aggressive CO2 every year? No. You can do an aggressive CO2 now, follow up with a Virtue RF treatment in a year, or do a couple of cool peels in a year. There's plenty of options for maintenance that have less downtime. And if you start feeling like you need an aggressive one again in a couple of years, you can do that. But usually you're not going to do more than one aggressive CO2 in 1 year. Is it usually one session or more? What is the cost? I got that one. What does the recovery look like? Skin peeling, redness, why 3 versus 10-day recovery? Okay, so I think I kind of answered that, but I'll kind of review that. The skin peeling is more if you're going to do an aggressive treatment. If it's definitely going to be red whether you do a light treatment or an aggressive treatment. A cool peel treatment is going to be red primarily, a little sandpaper, but mostly red for about 3 days. If you're going to do a more aggressive setting, a higher energy setting, denser, more delivery of heat. Sorry about that. And more delivery of heat, then you're going to have anywhere from 7 to 10 days of downtime. And again, that's more of a consultation about what are you looking for? Are you looking for aggressive? Are you looking for a lighter one? You know, are you okay with the downtime? Can you have the time off if you need it? Because I came into work the next day. Not everybody's going to do that. I work in an environment where that's fine, and people expect me to partake in the things that I do, but not everybody can do that. So it definitely depends on what you're trying to achieve. Does this affect beard growth for men? Not at all. You will have to shave if you're going to treat in the beard area. You may have a little singe of some of the hairs there, but they're not going to be affected long term. This does not remove hair. We have to have a specific type of laser to remove hair, and this is not it. It may, like I said, singe the hair at the surface a little bit, but it's not going to stop the hair from growing. With the laser open, closed pores? No. Well, I mean, if you're talking about something like milia, sometimes milia people call a closed pore, basically where you get a little bit of sebum trapped underneath the skin. Yes, that can happen. If you're getting fresh new skin, you'll find those milia will sometimes surface and pop out, the little white heads, basically. So that's a possibility. But other than that, it's not going to affect or make your pores bigger. They're actually going to get better and smaller. I've had a Fraxel before. Is this similar or stronger or better? Okay, that's a good question too, because Fraxel is a brand. Like Tetra is a brand and Total Effects is a brand. Cool Peel is a type of treatment with the Tetra brand. The Fraxel is a brand, a different company named their device Fraxel. However, they have several different types of lasers named Fraxel. When it first came out, it was Fraxel Restore, Fraxel Repair, Fraxel Revive. Now they have a Fraxel Duo. Basically, the only one that kind of equilibrates to or is similar to is the Fraxel Repair, which was a CO2 laser. I'm not sure a lot of people have that, and I don't think anyone has that in this area. I believe that there are some Fraxel duos around, which I believe is an erbium and a non-ablative laser at the same time, which is an erbium laser just doesn't go quite as deep as a CO2 laser, and pairing it with a non-ablative laser is nice to help to stimulate collagen. We have a non-ablative laser as well that's an option to help stimulate collagen, but you can also do that with cool peels. So definitely a little different depending on which one you had. And if you know the specifics of what you had, I can again respond to you personally once I find out which laser that is to tell you what the difference would be. Is this a good treatment for melasma? No, Definitely not. Melasma is something that doesn't sit on the surface of the skin. It is produced deep underneath the skin where the cells lie that produce pigmentation. And you can actually worsen a melasma with any laser treatment. The goal with melasma when you're doing a laser treatment is to minimize redness and inflammation as much as possible. There are some things that can do that, like the Pico Way laser has a resolve handpiece that can help with melasma, but it takes several treatments and it's designed at targeting that pigment without causing a lot of heat in the skin. The more heat you put in the skin, the more inflammation you get in the skin, the more melasma gets worse. So we definitely don't want to treat melasma with this laser. Could this tighten the cheek area enough to help avoid fillers? No. Well, you mean you can get some tightening, but you're not going to get volumization. If you need volume, you need to put volume in, whether it's stimulating that volume by a deeper treatment, putting in fillers, having surgery and putting in fat into the area, putting in something like sculpture that will stimulate your own collagen. Those kind of things are what give you volume, and fillers give you volume. CO2 laser is not going to give you volume. It will just help with that surface texture. Is this good for people with rosacea? Yeah, you can do this for if you have rosacea. It is not necessarily used to treat rosacea, but I have seen improvement in rosacea with this because people have these little vessels superficially, and this laser will target that area and sometimes just ablate those vessels. It's not meant to, but I've seen it over and over again that people do get improvement in redness and rosacea sometimes. But I wouldn't use that as the first line choice. If you're primarily concerned about rosacea and treating your rosacea, then there are other better options. But if you have rosacea and want a CO2 because of the other reasons, the improvement of texture, it's not a problem that you have rosacea. You can absolutely do the treatment if you have rosacea. How does the cost of CO2 compare with the traditional laser treatment? Okay, so traditional laser treatment is a question for me. I'm not quite sure what you mean by traditional laser treatment, other than if you're talking about a traditional CO2, which is the old style fully ablative CO2. It was when they shaved off the entire layer of the skin. When that was done, and it's not generally done that much anymore, that was raw skin for at least 2 to 3 weeks, oftentimes a month, and then at least 3 to a year of redness afterwards. And sometimes people lost the pigmentation in their skin as well. So that fully ablative traditional CO2 is not done very much anymore. It is not done only in one area. If people do that, it's a full face so that you don't have a discrepancy in the pigment afterwards. The fractionated CO2s that we have and that most people have now are not at risk for creating pigmentation changes and don't have that intensive downtime. What exactly does downtime mean? Downtime is different for different people in that some people, like me, I had completely swollen face and, was a little uncomfortable, and I was still doing aftercare, yet I came to work. So it wasn't really downtime for me. But someone who has that and works in the public might not want to go to work, won't want to go to work for a while until they heal, basically. It doesn't mean you're laid up. It doesn't mean you're flat on your back. It just means that you have a visible healing time that other people will see. And if you don't want that seen, then we call that downtime, and you're going to have to be not in public or at home from work that day or for several days, depending on the level of aggressiveness with the treatment. Can you go outside? So yes, you can go outside. Do we want you to protect? Absolutely. We want you to protect with hats and sunscreen and that. If you're going to do a An aggressive CO2, you can't really even put sunscreen on for the first probably 5 days, 4 to 5 days, depending on how aggressive you are, or I am for you. So, if you're going to be in a really sunny environment, you're going to probably not want to schedule that CO2 at the time. So, that would be considered a downtime. You can't be out in the sun, then that's part of your downtime. You have to be indoors or at least be able to protect your skin. Are you able to use regular medical grade products before or after the treatment? Before, yes, absolutely. We do have you stop any kind of tretinoin, retinol, any harsh products for about a day or two prior. Afterwards, depends on your level of aggressiveness. If you're going to do a cool peel, after about 3 days, you can go ahead and use your regular products as long as they're not harsh. I would usually recommend you wait on any anti-aging, anti-acne products for about a week after a cool peel. With an aggressive treatment, you are not going to resume your regular products for at least a week to 10 days. And then no aggressive products probably for 2 to 4 weeks, depending on what you're using. Is this a one and done procedure, or could I require more than one treatment? Some people do more than one treatment. So if somebody has really deep lines around the mouth, sometimes I'll do 2. I won't do it right away. I usually wait about 3 months of healing before I do it again. But yeah, sometimes you'll want to do a second treatment to get even more improvement. But you're going to see a significant improvement even in just one treatment. So you don't necessarily have to do 2. But it's more of a, do you want more result and you have really deep lines, then sure, you can absolutely do a second treatment. It's not the typical. Most people don't do a second treatment. Most people will do it once, they're done, and then maybe do it again in a couple of years, or do a light treatment each year, or do something else each year to kind of help maintain. I have been told that I have too much skin on my face in a nice way. So instead of microneedling, it was suggested that I do a soft wave for the best benefit. How does CO2 laser versus soft wave compare? Okay, that's a really good question. So soft wave is an ultrasound device that delivers the heat below the skin. There is no effect on the surface of the skin, meaning there's no downtime. It's just red for 10 minutes and that's it. You go about your regular life afterwards and no one would know you had anything done. But that's delivering by focused ultrasound. It's focusing the heat below the surface of the skin. And you're putting that energy down deep where you can get more lifting. Can you do both? Absolutely. But if your concern is more textural lines, CO2 is going to be better. If your concern is more lifting and sagging, then a soft wave and or paired with ultherapy, which can go deeper than the soft wave. The combination is a lot what people do, start with the soft wave and then go deep with the ultherapy. And that's going to give you more of a lift. Now again, lift compared to surgery? No, it's not going to give you surgery. But all of these things are meant for people who aren't planning surgery and don't want surgery. So, you're not going to get a lift of folds with a CO2 laser. Will you get softening of the line that's in the fold? Yep, you will, but you're not going to see that cheek lift up and pull back. Right. After the procedure, you're able to be in the sun. You can, but we always want you to protect from the sun, whether you have these procedures or not. Prevention of skin cancer, hats, sunscreen, very important. And in the initial stages after the treatment, you want to be really good at protecting your skin. But is that preclude you from going in the sun for the rest of your life? No, I'm not gonna, tell you now that you've had your laser treatment, you can't ever go in the sun again. We want you to be able to enjoy your life, but protect your skin. It's important, not only for rejuvenating effects, but also for prevention of skin cancer. If I choose the more aggressive treatment, is the pain worse, and would it require a different numbing procedure? Okay, so yeah, if you're going to do a cool peel, a light treatment, that oftentimes people do it without numbing at all. But I recommend you numb, and just because it makes you feel more comfortable. And it's very comfortable with numbing. If you're doing an aggressive treatment, it requires longer a time of numbing, at least 45 minutes to an hour. And sometimes you're going to need additional like Pronox to go with it. I've never seen someone need a Pronox with a cool peel. But an aggressive CO2 is very common that people use Pronox. It's more the standard that people use it than they don't. Are the results permanent? Not unless you stop aging. So no. We definitely see long-lasting results, and people will see improvements for a couple years, but you're going to want to continue to regularly get something to your skin for preventive maintenance. You want to make sure that as you're aging, you're stimulating that collagen, you're helping that quality of your skin stay good. As a septuagenarian, is this still beneficial? Yeah, absolutely. I have seen amazing results as people even get into their 80s. So yeah, you can get great results with this. It's just a matter of choosing to do an aggressive treatment to get those deeper lines. How effective is CO2 laser on eyelids and under eye sagging? Very effective. It definitely, that thin tissue in the eyes responds extremely well with even less of the energy that we would use, say, around the mouth and the lip lines. We don't use as much energy around the eyes and still get fabulous results, although the eyes are sensitive and they're going to get very swollen afterwards. Basically little water sacs above and below the eye when you do the eyes. So it's definitely downtime, meaning you're going to have so much swelling first thing in the morning the next day that you're not going to want to go driving anywhere. It's going to be, a little swollen, almost shut. So definitely you need to plan for that. Have your groceries ready already. Does it help with skin cancer? Oh, so I wouldn't choose to treat something that is skin cancer with the CO2 as the primary treatment. It's not recommended. If you had one that no one recognized and the dermatologist said, oh, it's fine, and we treated over it and it will probably get a little bit better, but it turns out that that they were wrong and it was a skin cancer, it's not going to make it worse. It's just going to make it better. Is it going to treat melanoma? Absolutely. It doesn't prevent melanoma, doesn't treat melanoma. We're talking, when I say skin cancer and precancerous lesions, I'm talking the actinic keratoses and the basal cell squamous cells, things that people get popping up into their 60s routinely now. So it can help with prevention of that, but it's not going to necessarily be a treatment of choice for skin cancer. If you for sure have that. And if I suspected it, I would definitely have you go get a biopsy for that. Is the procedure for the entire face, or can I choose different locations on my face? You can absolutely choose different locations. You do not need to do the whole face. You just need to let us know what's your biggest concern. What does the downtime look like? I think we went through that. Could you discuss how effective for a red nose due to blood vessels on the nose? So it's not going to be a treatment of choice for red nose and vessels. We have a better treatment for that. It can help with the thickening of the skin tissue on the skin. Sometimes people get what's called rhinophyma, which is a thickening of the tissue of the nose, and we can definitely pare that down and smooth that out and get really great results with the thickening of the skin there from rosacea. But treatment of the blood vessels specifically, I'd recommend the V-beam treatment for that. And we can do that aggressively and get really great results as well. How does this compare to photodynamic therapy? It's very similar in that you're going to have similar downtime, but an aggressive CO2 is going to be a little more downtime than photodynamic therapy, although you won't feel as bad afterwards as photodynamic therapy. So with the CO2, you get it done, and then you feel great afterwards, even though you look like hell. You look in the mirror and you're like, oh my gosh, I still look like that. You forget that you look like, swollen and red and peely because you don't feel bad. It just looks bad. The photodynamic therapy is different though. You kind of don't feel well for a couple of days after that. But it's very similar in that you're swollen and you're red and you're peely. So the downtime afterward, the look of it is different. Isn't different. It's about the same with a little more swelling with the CO2, but you probably feel a little logy for a couple of days after photodynamic therapy, and you feel fantastic after CO2. You don't really have any discomfort really after. Do you have to worry about fat loss in the face from the laser? No, the laser can't get down deep enough to treat the fat. You're basically hitting the surface. You can't even get through the dermis completely. If you did, you'd cause scarring. So no, it does not hit the fat. Are there any skin types that should not have the CO2? Well, definitely darker skin types like Fitzpatrick 4, 5, 6, which are, kind of Indian skin would be like a type 4, 5, black skin would be a type 5, 6. Those types are more apt to produce pigmentation after a laser treatment. So we definitely can do it, but we want to prevent that pigmentation from occurring, and we would pre-treat with some skincare products that will prevent that from happening. But it can be done. All right. Several questions here that are repeats, so I'm just going through them really quick. Got another question about the jowls. Will it help to lift the jowls? It's really not it's not a lifting device. It's more of a textural improvement. Will some people see some lifting? Yes, of course, but it's not meant to lift. That's more of a soft wave oil therapy treatment. Okay. If you have a connective tissue disorder, we generally recommend you have a consultation, and we'll talk about specifics about your connective tissue disorder so we can decide if it's an appropriate choice for you. Can you use the laser on the hands? Absolutely. Fantastic for the hands as well. What's the difference between the cool peel versus the CO2? The cool peel is a CO2 treatment. It's just a lighter setting. So it's the same laser, same treatment, just a much lighter setting. Can you just do the eye area? Yes, absolutely. There's no extra charge for the laughing gas. Will the cool peel help with sunspots? Yes, you can get improvement in sunspots, but we do have a better treatment for that. Our Peak Away laser does a beautiful job at lifting sunspots off, and you can just target the one sunspot or several sunspots and get rid of them quickly. You don't have to do the full face cool peel to get rid of them, but you will have some lightening of sunspots when you do a cool peel. Can you drive home? Yes, as long as we didn't give you any pain medicine or anti-anxiety medicine for the treatment. The Pronox, if you do that, is fine. That wears off in about 10 to 15 minutes and you don't leave the office right away. So yeah, that will fully leave your system very quickly. How do I know whether this or Botox or filler would be better to get rid of my wrinkles and lines? I would recommend a consultation, and we can talk about it, your specific situation, because some people need a little bit of both. A little bit of filler to help plump things up and a little bit of CO2 to help smooth the lines. Is Sculptra comparable to microneedling with laser? Sculptra is a collagen stimulating filler. We call it a biostimulator. It's basically injected underneath the skin and helps us stimulate collagen. So it's not going to really do anything for that surface texture unless there's enough loss in volume that it's affecting the texture. But most of the time, if you want the improvement in texture too, you need to do laser treatment. Eyebrows. Yeah, we definitely we need to stay away from the eyebrows so we don't singe the eyebrows. But if we were to treat over an eyebrow, I mean, I don't recommend it, but it will grow back. It's not something that disappears with laser treatment, with a CO2 laser treatment. But we try to not treat the eyebrows and treat around the edges so that we're not singeing it, because we don't want you to have to grow your eyebrows back. All right, how does your laser treatment differ from luminous ultra pulse? Well, a CO2 laser is what we're using, and we do have an ultra pulse as well, which is the total effects laser. We generally meet with you to decide what's going to be the best choice for you, but yeah, the CO2 is what we're talking about in general, and we have options for that. How does CO2 compare to IPL? CO2 is really getting fresh new skin, and IPL is just targeting pigment and redness. It will stimulate a little collagen, but it's not actually lifting skin tissue off the skin. And what type of pain meds am I recommending? Typically, I don't recommend pain meds. If somebody is really desperate that they need something, I will absolutely give them either a little bit of hydrocodone or a little anti-anxiety medication, but I find that the Pronox is really what most people prefer. If you're going to have pain meds prescribed, you have to have a driver. I won't do treatment unless you have a driver that day. Can you do PRP after CO2? Absolutely. All right. So we're at the end of this at this point. I've got one more question I'm going to answer here. Let's see. Let me pick a good one. Yes. Okay. One of them was, do you need a driver? Yes, you need a driver if you get pain medicine. How long before you can return to exercise? So you can do your exercise. I'm not going to tell you not to exercise. You may not feel like it the first day, and you're going to get very red when you do it. You can shower right away the next day, so that's not a problem. You're just going to pat it dry and resume your aftercare. So you can exercise. Do I recommend standing on your head? No. Doing those downward dogs are going to rush blood to your face, and you're going to hate it. So you'll basically do what feels good, what feels right. All right. As a reminder, we're at the end here. You will be receiving a text message at the end of this, and we want you to reply with the word laser. When you reply with that, you'll be in contact for a consultation, and you'll be entered into our raffle. Remember, we are raffling off a free cool peel treatment, and the raffle will be announced tomorrow, and you'll get winner will be notified by text. If you want to partake in our special from the event, basically our special is 20% off any choice in treatment, whether you're going to do a small area for $1,250 or a cool peel for $1,250, or if you're going to do a full face for $2,200, you will get 20% off whatever you choose to do. And that 20% off needs to be purchased by the end of May, 2025. And then you need to make sure you have the treatment done. I know a lot of people aren't going to want to do it in the summer, so we're giving you to the end of the year to have the treatment done. If you're not sure what you want to do or which is right for you, you're definitely going to want a consultation. Our consultations are being done by Allie, and Allie will go over your particulars. If she needs to speak to me, she will. We're having her do all of our consultations for this so that we can get everybody in, because there's a lot of interest right now, and I know I'm already booked out through May, so you're not going to likely get in to see me before then. But Allie can help. She's fabulous, and although she doesn't do the treatment for the aggressive CO2, she does do the cool peels, and she can help you decide what's going to be best for you. And if there are any questions, she will definitely come see me about that. So get your consultation scheduled, get in to see Allie so that you can decide what's best for you and what you want to purchase, if you want to purchase, and then we'll see you soon. I really appreciate so many people came tonight and stayed to the end, which is absolutely great. And I will be available for consultations. I know my schedule is booked up until June, but after that, if you want to see me, I'm happy to see you. But if you want to get in on the special, definitely get in this month. And what else? That's it, I guess. Thank you so much. I really appreciate it. It's really nice to see a lot of interest in some of our treatments and devices, and I hope to see you all soon. Bye-bye.